Uh, Today I am discussing very difficult case in a pediatric infant stone. Infant stone management is difficult. There are two stones in the kidney which are of reasonable size, more than 1 centimeter, one in the inferior calyx, one in the pelvis. We planned for stenting and RIRS or mini PERC. Then the ureteric orifice was so narrow, first time I could not pass ureteric catheter to do RGP also. Then what I have done, I wanted to explain in schematic manner here. This is the small kidney around 5-6 centimeters. This is the two stones, and when the ureter is there, it was narrow here, and bladder was like this, and this rest of all the things normal. When I went with ureteroscope, first 6 by 7.5 has not gone, 4 by 6.5 has not gone. It is stopping only at this area, just half centimeter below the, at least if I engage, I can do something. Then I tried to pass ureteric catheter, not gone. I tried to pass the 0.018 guide wire termo. It went up. However, that I could not stent it. Now I don't have an option. I thought I will do PCL ultrasound guided because dilatation was there a little bit. Then ultrasound guided, I did removal of these two stones. After that, I tried to pass the stent. It did not go. The one mistake I have done is I might have passed a flexible scope and then passed a guide wire. That I did not do. Then what I did is I passed the stent and it stayed in the ureter here, upper ureter. Now I left. Now PCN was there. PCN I kept. But after 2 days, PCN slipped off, unfortunately. This is the worst thing happened. Then patient did not had any problem. Urine used to come down. So I waited for 3 weeks. Now, after 3 weeks, when I went inside, the ureteric orifice is still narrow, not allowing 4 by 6.5, not allowing 6 by 7.5 ureteroscope, but allowing only the ureteric catheter. That is good. Then I put 4 French ureteric catheter for 5 minutes. Then I changed with nephroscope in the urethra, 6 French, 5 minutes. After that, I tried ureteroscopy. It was not possible. After that, I tried balloon dilatation, where this small area I did balloon dilatation up to 8 French. Then ureteroscope has gone. Then I pulled this stent down, and at the moment I kept the stent because natural dilatation. But one thing is for sure, in the entire process, I have not damaged this ureteric orifice by myself. It is per se narrow in the small baby. Sharing the video. Continuation of that discussion, I am sharing what exactly happened in this small. Actually, this is 9 months baby. The excessive crying for 1 week, around 7 mm calculus in the upper pole, 12 mm calculus noted in the lower pole. And now you see what happened actually, you can understand here. In these 5 minutes, and later on what happened afterwards. These are the two stones. They are not very small, meaty kidney. See, the one stone is not the stone, it is a rib. This box is the stone. See, first thing in children what we do is we pass a guide wire. See, when you see the orifice, see some amount of the stone particles. See, this has not gone. This stent, we thought we will stent it. Stent has not gone. So there is no trauma here with stent. It is a soft end stent. There is no trauma. Now we passed a guide wire. Then the guide wire. See the within half centimeter the orifice. We have not damaged anything, but guide wire has gone. That means we are in safe. CIAM is used. Everything we have to think that we should not damage the ureteric orifice. If it is naturally, then see now already the mucosa is completely intact here. This is the absolute narrowing within half centimeter of the mucosal junction. Now we tried the ureteric orifice. During this time damage happens, still we were very careful. Only mucosa was getting intussuscepted. Then ultrasound is used, then the ureteric catheter did not go over the guide wire. Then ultrasound had some hydronephrosis luckily, and so nicely we have the hydronephrosis. So in a clearly under ultra-see, see the needle. In children, needle will be seen so nicely because of the this thing, and it is punctured, and immediately urine has come, and I injected a little. I don't inject normally contrast, but dilute I have injected because I wanted to pass the guide wire. Before that I wanted to dilute inject, otherwise we should better avoid. Now I have taken a larger needle because initially I punctured with spinal needle. Now see, can you see the needle clearly in the PCS? Initially to assess or inject contrast I have done that. Directly now 18 gauge needle I passed. Very well the system is delineated. So I went inside, did mini perk and removed the stones. After removing the stones, as I said, stone removal is not a problem. And see, actually in this case, first I punctured with the spinal needle 27, which is wrong because guide wire did not go. By puncturing it is of no use, but I injected little contrast, delineated the PCS. Now you see here, I went inside. This is one more problem is this is under dilated. So then I slowly negotiated with my experience, and the stone is seen, and we made into two pieces. See the beauty of the vision here with nephroscope, and 4-5 pieces they are removed, sent for analysis. This is the second stone, and clot was coming in the view. After removing the clot, it came out nicely. There is no problem. And we have not used any forceps here, but forceps can be used. You need not struggle. It was coming by gravity. There is no pressure from below because you don't have an access from below, and this is the upper calyx, small fragment is going. Moving in children from one calyx to other calyx is very easy, and now I am going through the PCS and I tried to pass the stent. I might have passed a guide wire that I did not do, but I must tell you I could not identify the PUJ for certain period of time. After that, with a lot of difficulty, I could pass the stent across. See here, I thought already ureter is problem. If the PUJ is also problem like this, and if I damage, it's a disaster. So under CIAM guidance, carefully see. Now these are the mucosal folds, very clearly seen. And then with a small nephroscope, I passed the guide wire. Luckily, it has gone, and at that level I tried to pass over the guide wire and it did not go. So guide wire also curled at the lower ureter. That means lower ureter is very narrow. See, with a lot of difficulty I pushed, then that I coiled here. At this level I thought I will stop, so many problems are happening. Then I stopped case here. So then much of the stent was in the PCS. Then I have put nephrostomy. Then subsequent video after 3 weeks I am showing as the external video so that the voiceover will continue. Right renal stone, 2 stones were there. Plan was to do mini perk bar RIRS. Ureteric orifice did not admit the ureteroscope 6/7.5, 4/6.5. It did not even admit the ureteric catheter for French. It admitted only 0.018 guide wire. Now we were in trouble, so ultrasound guided PCNL done, not to wait the anesthesia. Now that is the picture there where stent has not also gone antegrade. Only thing we have not done is we might have used flexible ureteroscope to pass the guide wire across the ureter. We missed that. Now we kept the stent there so that some drainage will be there. Unfortunately, PCNL pulled out on post-op day 2. Now this is the picture. Coil is there in the above. Plan is to go inside and see through the small penis, small urethra, small ureteric orifice. I am thinking that the ureter might have dilated. If the ureter is dilated, the 6/7.5 and forceps will remove this thing. If not, 4/6.5 and dilate the lower ureter 2 cm for 5 minutes and try to do. If that also fails, ultrasound guided puncture and removal of the stent and leave later on for the lower ureter to heal. Because it was there as it is previously, we have not done any damage to it. That is the plan. So now let us see here in the orifice. This is a small orifice. We are going there. So this is the membranous urethra. This is the prostatic urethra. This is the orifice. Now you can see the orifice clearly. We will pass the guide wire. carefully pass the guide wire. It has gone. CM below. Yeah, guide wire has gone up to this stent. Now, how to dilate this? Okay? See now, CM. Now guide wire has gone up to there. Now I want a ureteric catheter which can go through this easily. First, normal ureteric catheter. Now you should have patience. Saundarya, am I correct what I am telling? If any small balloon goes through this, it is good. Or else we have to cut the ureter. That is also not good in children. Reflux can occur. Now only serial dilatation is the only option. So let's hope we dilate and keep for 5 minutes, and then record the time there. Record the time there, 11:30. So we will come back at 11:35. You keep it like this. Can you hold it? Yeah. From there you can go. See how better off. If it is constricted at the beginning, it will traumatize. Now only option is make it wide over a period of half an hour. It's a lifetime for him. It's kidney lifetime. So what you do, 4 French, you keep it for 5 minutes. It will dilate. After that, you take a nephroscope. Small nephroscope will be there, not 12 French. Through that you pass this guide wire, and through that you start dilating with the 6 French, 7 French ureteric catheter. After that, you take one dilator through the nephroscope guided only. If possible, 15 French use it. So 12 French, 15 French nephroscope should be here. Through that, whatever dilator goes, you should pass and dilate for half an hour. Then go with ureteroscope.
15 French nephroscope through the urethra.
No, first 12 French. Urethra also will get dilated. You put Foley's catheter, na? Once you put Foley's catheter, 1 or 2 months, urethra will get dilated. That we will see. Ramakrishna, scrub. In the worst circumstances, this is RFI's 4 French has gone. Now 3.5 French stent can go. Or else you keep this ureter. Last time this ureteric catheter has not gone.
Yes, sir.
Now it has gone. Even if you keep this ureteric catheter for 3 days, maybe you will definitely get dilatation. You got the point? This is called soft dilatation, which you use for the urethral stricture. Emergency measures. If you understand my point, that's the important. Ureteric catheter, whether it goes or not, we have to see. This is the 12 French Carostage nephroscope, through which this large ureteric catheter we will keep for some time. Why don't you wait for 5 minutes and slowly see supple that is. Can you see? Suppleness. That is also important. Always you come like this, so that guide wire will not move 1 millimeter also back. See, this straightening is very important for the juniors. This straightening, you have to go away like this. Entire length of the ureteric catheter you have to go away and then hold here. Now what we have to do is, we have to pass this, slowly go there, pass this and then come out, and some person has to hold tightly with 2 hands. Now other sister has to hold this and take it out. 2 hands you have to hold and take it out. Now we have to pass this. Anta peddavi povunanna.
In the 6 French.
No, what I am telling you, 6 French unda dantlo. Yeah, you open that 6 French. We will see whether it goes through this or not. Otherwise, take 15 French. So this is the small nephroscope. I hope it will go easily. This child is how much age?
10 months.
See, engaging the meatus is very important, Ramakrishna. I engaged. Okay. Okay. Okay? Good. Now CM please. Okay. See, go above where the guide wire has gone. Yeah, guide wire has gone into the kidney. So even if I put a stent, you got the point, Ramakrishna? 2 stents, there is no problem to the patient. Anyway, this stent has to be pulled down. You cannot remove the stent today. But still is an edema, na? After this much manipulation. See, now you hold it. This is another 5 minutes, you show the time there. Hold carefully. Another 5 minutes. 5 French. Now, in this scope, whether 6 French goes or not, you have to see. You got the point? This is the ureteric catheter. I never used this. This is the first time I am using the ureteric catheter dilatation, because this child we cannot do anything. When you are not able to pass the stent, we have to. If this goes, it's very good, Ramakrishna. This is 6 French. In this, if it goes, it's very lucky. What do you say? Yeah, you keep it this summer. You know what is the next step? You can use over the guide wire this stepwise dilatation under CR. That is the last option. Then you go and pull the stent down or put the new stent. You have to go back like this. This is very important point. నేను ఎన్నిసార్లు గొడవ పడేది దీంట్లో ఇది కానీ ఎవరన్నా పట్టుకున్నా కూడా నాకు రెండో సెక్షన్ లేకపోతే ఈ మూడు చాలా ఇంపార్టెంట్. Now you seen 6 French. See carefully, 5 minutes we are dilating. Whether this goes through the 12 French access sheath, we don't know. This nephroscope. If not goes, we will use directly. In that case,
13 French. దాంట్లో వెళ్తుంది.
13 French లో వెళ్తుందా చూసావా? 13 French scope is better. Jai Bajrangbali. No, it's not going. So take it out. 6 French dilator is not going. So he will pass into the 13 French. This is surely 13.8. So every French matters in urology. You can't say one French only, sir. What is the difference? You got the point. Every French matters. Okay. Now bladder is full. So you should empty. Gently press also, it will come out. In posterior urethral valve, it does not come. This will not come. Yes, you know that? This in the general anesthesia, this relaxation will be there. But ideally, you should not press like this and empty. You should do. He told in the beginning only that no bleeding, no pressure will rise, reflux will be there, fever cannot, feeding tube. But I cannot accommodate feeding tube, na. So that's why I am this only whether I can accommodate or not. See, it's going. See, it's going. 13.8 is growing in which age?
10 months.
10 months. People say, why you are putting 9.5 access sheath? Urethra is distensible. Only thing is that you should have expertise. Should not damage the mucosa. కొంచెం జైలకెన్ జల్లి పట్టించునా for the frictionless environment. With the now water press. Easily it is going. It is only 1.8 French. Here Ramshna, 1.8 French. But see this urethra, how it is nicely seen. Any damage? Any damage? Mucosa? Any damage? Nothing. Absolutely normal. So it should not coil now. That's what Ramashna is saying. See, it's the mistake of the. See now, can you see the orifice dilatation? It is not now scripting now. It is opening. No other method can be used in children. Laser, cutting, you should never use. Lifelong damage it will happen. So I am passing this. See, this is the difficulty. It's going. At least see, at least see now. You got the point?
Yes, sir.
Yeah. Why are you moving up? Come down. I never told to move up. Yeah. Right.
దీనికంటే మనం ఒక ఫ్రెంచ్ చేయగలిగితే యూరోట్రోస్కోప్ వెళ్ళిపోయింది.
Yeah. దీనికంటే ఒక ఫ్రెంచ్ చేయగలిగితే యూరోట్రోస్కోప్ will go. If you don't want to do that, there is one technique. You have to use 4/6.5 with a basket and get this stone, this stent only down slowly. That basket should be Dakota basket. Whether 4/6.5 allows the Dakota basket or not, we have to see. You allow, but Dakota basket you open. See how much I am using. Dakota can hold the lower part of the stent and then slowly you bring it and leave it.
Yes, sir.
So that upper kidney is saved, lower kidney, upper ureter is saved, lower ureter is saved. After the 6 French has gone, open. We want to open the 6 French balloon and check and then do dilatation for 5 minutes. Then 6/7.5 ureteroscope will go. You got the point?
బెలూన్ డయామీటర్
Show here.
యాక్టివ్ డయామీటర్
Already it's open.
దీంట్లో ఎంతైతే వెళ్తుంది
ఏది వెళ్తుంది? That will go. I want to use this, Ramakrishna. Aja, this has to go or what? No.
ఏది
This has to go. This will go easily.
6 ఫ్రెంచ్ కదా,
Yeah.
ఈ బెలూన్ డయామీటర్ ఎంతో చూసుకోవాలి.
ఈ బెలూన్ డయామీటర్ మనకేం ప్రాబ్లం, ఎంత కావాలంటే అంత ఇంజెక్ట్ చేయొచ్చు. యా, సెలైన్ తీసుకో.
5 mm అంటే 15 ఫ్రెంచ్ దాకా డైలేట్ చేయొచ్చు దాంతో.
మనం అంత కూడా అవసరం లేదు మనకు. నవ్ ఐ విల్ ఇంజెక్ట్ ద కాంట్రాస్ట్. కాంట్రాస్ట్ కూడా 2 ml 5 ml కావాలన్నా. See now this is now it's opened actually. No need. Should I try ureteroscope once over the guide wire and why to dilate then balloon? Okay. Hold it. Here ureteroscope will go. If it goes, okay, leave it. Now I am taking out the nephroscope. What will I do now? I will pass the ureteroscope. Okay? Pass. Gently you have to pass. Ureteroscope is also a dilator, visual dilator, not blind. So go back. Go back is the secret. Only thing is that this obliquity we have to observe. Anna? Okay, you put it. I am passing this. I am not going into it. సెలైన్ తర్వాత ముందు తీసుకో. రైట్, ఎట్టి పట్టుకున్నా. నౌ ఇట్ ఈస్ వెరీ ఇంపార్టెంట్ స్టెప్. రెట్రోగ్రేడ్ పాసింగ్ ఆఫ్ ది గైడ్ వైర్ త్రూ ది యూరెటరోస్కోప్. గైడ్ వైర్ కొంచెం లాగండి, వదిలేసి చెప్తా, నాకు వదిలేసి నేను తీసుకుంటాను. గైడ్ వైర్ కొంచెం లాగనున్నా. బస్ 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 బస్, అంతకంటే ఎక్కువ లాగద్దు. కొంచెం జైలోకి వెళ్ళి దాని మీద పెట్టేసి గైడ్ వైర్ని కొంచెం టాట్ పెట్టి రామకృష్ణ. నౌ గైడ్ వైర్ షుడ్ నాట్ స్లిప్. జై బజరంగ బలి. సో నౌ వాటర్ ప్రెస్ a little bit, no problem. Okay. So it's not going, Ramshna. I think this is the ideal case for the balloon dilatation. Give the balloon dilator. This is the ideal case for balloon dilatation. Over this will pass or over the nephroscope? Nephroscope you give. You got the point. Rigid scopes doesn't go easily, Ramkrishna. So we should not force them. Yeah. Agnana, 2 things don't do.
Stabilize.
Okay, stabilized.
Yeah.
No problem. I am stabilizing here. Wait, Amma. Let him do it. Don't be in hurry. No 2 things at a time in endourology. One stabilize. సియామ్ కిందికి రానా ఎక్కువ సియామ్ చేయొద్దు పేషెంట్కు. రా ఇప్పుడు పెట్టు దీన్ని. శ్రీధర్ గ్యాప్ ఇచ్చి గ్యాప్ కాంట్రాస్ట్ తర్వాత ఇంజెక్ట్ చేద్దాం రామకృష్ణ.
కాంట్రాస్టే బెలూన్ ఇంజెక్ట్ చేయాలి.
అవునా? వాటర్ ప్రెస్
మనకి తెలిసేది ఎంత డైలేట్ అవుతుంది.
ఐ డోంట్ థింక్ సో బట్
కాంట్రాస్టే.
ఓకే, నౌ నో యూరెథ్రల్ డ్యామేజ్. ఓకే, యూరెథ్రా షుడ్ నాట్ బి డ్యామేజ్. కమ్ ఆన్ గివ్ మీ. ఇది ఓన్లీ 1 centimeter పంపించాలి రామకృష్ణ మనం.
ఇది 5 centimeters. హాఫ్ పంపించినా చాలు.
హాఫ్ పంపించినా చాలు.
టిప్పు కొంచెం
లోపల పోవాలంతే. దీన్ని మనము సియామ్లో ఎట్లా ఉంటుందో చూపించాలి. దిస్ ఇస్ ద ఫస్ట్ టైం ఐ యామ్ యూజింగ్ ద బెలూన్ డైలేటర్. ఓకేనా? ఇట్స్ గోయింగ్ ఈజీలీ త్రూ దిస్ నెఫ్రోస్కోప్. దట్ ఈస్ అ గుడ్ పార్ట్. నౌ నెక్స్ట్ స్టెప్ ఈస్ వెదర్ ఇట్ గోస్ ఈజీలీ త్రూ ది. It has gone. It has gone. It has gone. Now it has gone. Siam now. See that. Can you see the dilator tip? Yes, small dot. Now you inject the contrast slowly. Dilute contrast you inject better. Now you record this dilatation, what's happening here. See, that waist will come. Wait, remove it. Complete will pass inside, remove it. Because it's half. Yeah. So now I am passing, Ramakrishna. I am passing completely. Now can I inflate now? Slowly inflate. Okay, see it is descending. So that is the balloon. Inflate. See this dilatation now. Okay? See the dilatation. See the wasting is there. Say there. Can you see it? Okay. ఎందుకంటే already balloon is there. See very good, Ramakrishna. Your idea waist is there. Can you see? ఫైవ్ మినిట్స్ ఉండాలి పట్టుకో. ఆ వేస్ట్ను మనం రిలీవ్ చేయాలి యాక్చువల్గా. ఇంకొంచెం ఇంజెక్ట్ చేసినా పర్లేదు. కాంట్రాస్ట్ సిఎం బస్. దట్ ఈస్ ద నారోయింగ్ ఆఫ్ ది లోయర్ యూరెటర్. Now you off it. Now you keep it. Whatever dilatation, let it happen. Hold it. So that is the dilatation. So under and Raman. A waist disappear అయిపోతే బాగుండేది. In the bladder, that is the orifice, that is in the ureter. This is quite lengthy for this ureter. Ideal, na? This is the case ideal, na? Now I will try 6/7. ఇంకో సిరంజ్ తీసుకొని ఎందుకురా
సో డీప్లేట్ చేస్తాను అక్కడ చూపించు.
సిఎం డీప్లేట్ ఇంకా డీప్లేట్ కావట్లేదు. వెయిట్ ఇంటర్మీడియట్ కొట్టు. సిఎం బస్ డీప్లేట్ and C-plate. You observe there, it's not coming. Here, deflate. ఏమన్నా తీసుకోవడం
ఇంత ప్రజలకే రావడం లేదు. వస్తుంది ఒక్కొక్క
నేను తీస్తున్నాను ఇక్కడ డైలైట్ చేసుకుంటా. గాట్ ద పాయింట్. See, I am removing slowly.
That is a good sign.
That's a good sign. Okay. No. Guide where please. ఇప్పుడు చూడు. See that is dilator picture, you take it. This is the dilatation. Guide where తీసేసాను. Guide where జాగ్రత్త. రామకృష్ణ స్ట్రైట్ వెళ్ళు. Guide where జాగ్రత్త. Guide where ఇప్పుడు రాకూడదు బయటికి. Okay. Now take out. Now it should go. ఎరా చలో. అరే గైడ్ వేర్ వచ్చేసింది రామకృష్ణ. చెప్పాను కదా నీకు నేను. గైడ్ వేర్ రాకూడదు రామకృష్ణ. గైడ్ వేర్ రెడీగా పెట్టుకున్నాను ఫస్ట్. లేకపోతే ప్రెస్ యూరెథ్రా ఇస్ నార్మల్. సో జై బజరంగ బలి. నౌ okay Ramkrishna. Yes. See now easily. Excellent. So that is the stent. Okay. So now for attendance pilunana we will show. We will keep this ureteroscope for some time being, Ramkrishna. CM. Yeah, that will be the stent end. No, I want to keep the stent. I want to put the stent below. అంతే కదా, వచ్చేసింది కదా. ఆర్పైస్ కూడా ఇట్స్ గుడ్ నౌ. సో దిస్ ఇస్ ద వే. సియామ్. యా. ఓకే, హియర్ యు షో. ఇంకొంచెం లావుదామా? పైకి చూడు. సియామ్ కొంచెం లావుదాం. యాక్చువల్గా కింద ఎక్కువ ఉండకూడదు రామకృష్ణ, పైన ఎక్కువ ఉండాలి.
ఒకసారి పైకి కూడా లాగేసుకుంటాయి.
దట్ ఈస్ ఆల్సో దేర్. సో ఈజ్ సేయింగ్ దట్ సీఎం కింద. ఓకే, perfect. Thank you, Police Gazetteer. And in this case, we have used our maximum expertise along with Dr. Ramakrishna, Sridhar, Soundarya. What we have done is, we passed the guide where it went. We passed the ureteric catheter, it went. Last time it did not go. We passed the larger ureteric catheter 6 French, it went. But still 6/7.5 did not go. Then we used balloon, nicely ureter is dilated, ureter is healthy, and then we pulled the stent and kept. Thank you.